Thank you for joining us today for our Supporting Successful Transitions into Self-Management of Food Allergy, Pre-Teen to Young Adult webinar, part of our Back to School webinar series. I am Jennifer Gertz, Executive Director of Food Allergy Canada, and our guest speaker today is Dr. Rebecca Knibb. Today's session essentially covers 4 areas. Dr. Knibb will start by taking us through the latest research in the area of mental health and impacts to those with food allergy, with a particular focus on preteens and young adults, and then will help us understand the actions that the clinical and research community are taking to address these issues, but also she'll provide perspectives on practical interventions you can consider for managing this transition. I'll then highlight some resources that are available through Food Allergy Canada that might be tailored to your specific needs, and then we'll spend the rest of the hour on questions and answers. Based upon your pre-submitted questions, there's some consistent themes, and I'd like to thank everyone for submitting those. We will take a good portion of the time today to be able to go through those. Before I formally introduce and welcome Dr. Knibb, I wanted to cover up just a few housekeeping items. Please note that this session is for informational purposes only and will not provide specific medical advice, recommendations, diagnosis, or treatment. Please talk to your doctor about any concerns or questions you may have regarding your own health or the health of your child. All participants are muted so we can keep the audio clear for the webinar. If you have additional questions during the session or are looking for clarification, please feel free to submit those in the chat question box throughout the webinar. And while we'll be focusing on pre-submitted, we will try and get to as many additional questions as we can. And also note that the webinar will be recorded and shared on foodallergycanada.ca afterwards. Now I'd like to introduce and welcome our guest speaker for today. Dr. Rebecca Knibb is an associate professor in psychology at Aston University in Birmingham, UK. She is also a chartered psychologist and practitioner health psychologist with 25 years of experience in conducting research into the psychological impacts of allergy. She is involved in the development of strategy to help families cope through cognitive behavioral therapy methods, and is particularly interested in how children cope with transitions to adolescence and cope with leaving home. So I'd like to welcome Dr. Knibb and turn it over to her for this presentation. Welcome.
Thank you very much, and thank you for that introduction. I'm absolutely delighted to be able to come and talk to you today about supporting successful transitions. I think it's one of the most important things we do as researchers and as clinicians to reconnect with the people that we see during a clinical appointment or see during research, that we reconnect with those individuals with food allergy and the parents and caregivers to tell them about the research that we're doing, tell them about the findings that we've found and the things that we're trying to do to support them. So that's really what this talk today is all about, and what the question and answer session at the end will be about. So to provide you with a little bit of an outline, I'm going to talk about the food allergy reality, which I'm sure you will all be very familiar with, but just to give background to let you know that we're all coming from the same position, that we know what the burden of food allergy is. I'm then going to talk to you a little bit about some of the research that's been conducted. There's been a lot of research over the last 25 years, so I'm just going to pick out a couple of things we've been doing recently. I'm then going to go through the actions that the research and the clinical community are doing, and what the things that they are conducting at the moment, and then some practical toolkits, some practical things that you might be able to do. And then I'm going to finish with just some interventions for additional support that you might be interested in hearing about. So let's start with the food allergy reality. This is something that I'm sure you're all very familiar with. We really understand that food allergy is quite a unique condition. It is a condition where the individual is generally well. The individual with food allergy doesn't have symptoms on a day-to-day basis like a lot of other long-term conditions, and their health is generally very good, but they have to avoid foods all the time. So there's that continual risk that there might be symptoms after eating. And there's that continual risk that this could be severe, be a severe reaction if they have a reaction, and it could possibly be life-threatening. So we can't avoid food, we can't avoid eating. So it's very different to if you're allergic to a cat or a dog, we'd be able to avoid coming into contact with them. We can't stop eating. So management of food allergy requires that constant vigilance in order to risk assess, to decide whether food is safe to eat, and to avoid certain ingredients which may cause symptoms. This continual risk causes a lot of anxiety, and we're very aware of this when we're conducting research, when clinicians are seeing people, very aware that although fatalities from food allergy can be quite rare, the risk of that potentially happening causes a lot of stress and worry. There's some research that suggests it occurs approximately 1 in 800,000 deaths per year. So it is a relatively rare occurrence, but it's always there, ever present in the back of your mind. And the risk often feels like it's much greater. And so we understand that this causes a lot of stress and anxiety, and it has an impact on quality of life. The research we've carried out and talking to parents, talking to children and teenagers with food allergy, found that this burden covers a whole range of things. And this slide just summarises some of those things on the right-hand side here. The main thing is that food allergy is very unpredictable. Children are well the majority of the time, and allergens hide. It's very difficult to pick them out. Often you can't see them because they're in such small amounts in the food. And because eating is something we do all the time, when you have a food allergy, it affects many areas of life, and particularly our social lives, eating out, going on family holidays. And it can affect the family dynamics as well. And there's been some research, which I'll talk about soon, which looks at the impact on both mums and dads within the family. Obviously, it has an effect on school trips, etc. And there is some research showing that bullying can be an issue as well. But these are all things that affect day-to-day life, affect quality of life, but there's also an economic issue here as well. Diets can cost more. We've had reports where parents have said they're not able to work, or it affects them being able to go to work. And there is the extra time and effort involved in looking at food labels every time you decide whether a food is safe to eat or not. And this can have a big impact on things like how long it takes to do shopping. So what about the research? You know that these things have an impact on your lives and the lives of your children. Are we seeing this in the research that we're doing? Well, absolutely we are. Research in this area has been carried out about the last 20 years to 22 years. We didn't see any research in this area until around about the year 2000. So it is relatively new. But over the last 20 years, the research is very consistent, demonstrating that food allergy has a detrimental impact on the lives of individuals with food allergy and their families. So a lot of research is focused on children and teenagers and on their parents or caregivers. A lot of that research has been focusing on quality of life and how quality of life has been impacted. So this includes things like people's physical quality of life, how they feel, their physical health, but also their emotional health. So things like stress and anxiety, their environmental quality of life, the environment around them, and their social networks, their social quality of life and their social life. But more recently, researchers also looked at things like depression, anxiety and stress, and found that these are also very much associated with having a food allergy or looking after a child or a teenager with food allergy. And there has been some research showing that in certain cases, we found post-traumatic stress type symptoms, particularly when somebody's had a really serious anaphylactic reaction. And this can cause these post-traumatic symptoms. And this is an emerging area of research. So just to give you an indication of the extent of the research that's been going on over the last 20 odd years. I've picked out this particular review paper just to show you. This is an open access paper, what we call open access, which means it's freely available for anybody to download and have a read of. And this particular paper includes 153 other papers. So this is just on peanut allergy, but as you can see, it includes research from a vast amount. And it reports on issues related to burden, including healthcare, socioeconomic issues, as well as the psychological burden of living with peanut allergy. And this burden includes a number of areas that I've already touched on. And although this paper is focused on peanut allergy, I think the areas that it's picked out are very relevant to food allergy to other foods as well. So as you can see here in this little box at the bottom, the reading the labels, the dietary restrictions, the issues with eating out, impact on schooling and school trips, impact on travel, quality of life, and those emotions like stress and worry. So that was the review paper, but there's also lots of research going on, asking parents and asking children how food allergy is affecting their life. And I've picked these two studies in particular, because they found some really interesting findings, which are quite different to what we were seeing perhaps even 15 years ago in this field. These two studies, these two papers, are based in the UK, and they're based on parents of children, again, with peanut allergy. But again, I think that the findings would be very similar in other allergies to other foods. But what we found in these studies is that it wasn't just the mums who were reporting that there was a big impact on their life, but the dads were also reporting this. And this seems to be a change that's happened over the last few years. It seems to be having a big impact. Looking after a child with food allergies having an impact on the dads as well as the mums. And we showed that it is having an impact on things like career and productivity, as well as quality of life. One of the other things we found as well, when we asked parents to tell us what the impact is on their children, we looked at lots of different things to find out what might predict a greater burden on the children's lives. And we found two things in particular. One was having reactions in the past 12 months. So if your child has had 2 or more reactions in the past 12 months, this seemed to significantly predict higher levels of burden for the child. And also parental anxiety. So when parents are quite anxious about their food allergy, this also predicted the higher levels of burden or poorer quality of life for the child. So it just shows how important it is for us to not only focus on the child or the teenager with food allergy, but to also make sure that we also focus on the caregivers. And then what about mental health? Well, a lot of the research that was carried out to start off with focused very much on quality of life, but we have had some research also focusing on things like anxiety and stress. And so again, this is just an example of a paper just to show you that there's a lot of momentum in this area, a lot of research being carried out looking at how food allergy affects anxiety. So this is a very recent review article published last year, and it's really excellent in providing a great overview of the research and shows that the impact on mental health is being very much recognised by the healthcare practitioners. I think this is something that I've found very much over the last 20 years, is that the clinicians that I speak to, the clinicians I work with in research are very much now very aware of the impact that food allergy has on people's lives and has on the lives of parents and caregivers. And this is a big turnaround from how it was 20 years ago, when the psychological factor within food allergy was very little was known about it, and very little emphasis was put on it. So we've come a long way in the last 20 years. But we still have gaps in our knowledge. There's still lots of things we don't know. One of the things is how much anxiety is good for us and how much might be bad for us when we're trying to manage food allergy. It's thought that actually some level of anxiety might be quite beneficial. It might encourage us to be a little bit more vigilant. It might encourage us to make sure that we carry our epinephrine devices with us, that we make sure we do avoid all of those allergens. But some of the research we found shows that actually if you prescribe somebody with an epinephrine device, it gives them this sense of security, and that might actually decrease vigilance. They might think, oh, great, I've got my EpiPen, but then they don't actually take it out with them. And this then obviously can increase the chances of somebody perhaps having an accidental adverse reaction and not having their pen with them to treat it. And we don't really know what level of anxiety is optimal. What's the right balance? Because of course, as anxiety gets higher, it has a bigger impact on our lives. It has an impact on what we feel comfortable doing, and it might then stop us doing the things that we enjoy. So we need to get a good handle on what sort of anxiety we need to look out for, and what sort of level of anxiety needs to be perhaps supported. So what sorts of things are we doing? What actions are the research and the clinical community taking? One of the things I'd like to talk to you about is a task force that was put together a couple of years ago. It's run through the European Academy of Allergy and Clinical Immunology, which we call EACI for short. And it's a task force to look specifically at adolescents and young adults, and to look at their allergic diseases. And this includes all of the allergic diseases: food allergy, eczema, hay fever, and as well as asthma. What we're aiming to do within this task force is to look at the challenges, the needs, and the management strategies of adolescents and adults. And what we've been working on is to produce some really clear recommendations to healthcare providers and for adolescents and young adults and their parents and caregivers. And we've published these guidelines now. And these guidelines, although they've been developed by a European task force, we've looked at research published all over the globe. So we're not just focusing on European research, we're focusing on the research that's been published all over the world, and our guidelines then have this global application. Just to give you an idea of the extent of the task force, here are all the members. We've got many different members who come from lots of different backgrounds. So we have dietitians, we have clinicians, we have psychologists, researchers, all within the task force, and they come from lots of different countries. Most of them are European, but we also have members from Russia. So we've been collecting evidence to try and identify what the challenges are and what interventions might help. This is the first thing we did. And we looked at all of the research which focused on the challenges and the specific needs of adolescents and young adults with allergic conditions. And these were used to shape a guideline and some recommendations, and we've published this in the journal Allergy. We also looked at what interventions are helping. Are there any interventions out there that are helping our adolescents and young adults improve the way in which they can manage their allergic conditions? Again, we've used these to underpin a guideline and our recommendations, and we've published this with you as well. I don't want you to get too confused about this slide. What I really want to pick out for you, again, is the extent of the research that has been conducted in this area. So on the left-hand side, we have our challenges systematic review, all the different records that we identified to start off with, and we whittled these all down using our inclusion criteria to get to the studies that all looked at the challenges for this participant group, and there were 108 of them. So you can see the amount of research that's been taking place in this area. Only 19 were on food allergy, so we do have more work to do. You can see a lot more studies were on asthma, and most were from America, but almost half of the studies were from America, and the rest were from Europe. So you can see that although this is a European task force, we're looking at a lot of research that's coming from North America. So the intervention systematic review, it really told us what we still need to find out about, and that really is what interventions are going to help our young people with food allergy. Because when we looked at the interventions, we found only interventions for asthma. So we've been able to look at what's worked with asthma to see whether it's going to also work for food allergy, and this is what we now really need to focus on very urgently. So I just want to give you some of the sort of headline findings, and on the left-hand side you'll see these are the findings from the challenges, and the challenges really for our young people, our adolescents and our young adults with food allergy and with asthma are these issues with mood disorders, depression, anxiety, stress, social anxiety about having symptoms, having to take medication, use their EpiPen when friends are around, that they might feel really stressed and not really know how to cope. They may get into arguments with some of their friends or people at school or with their parents. But there are also lots of protective factors we found. So parents giving lots of support. This led to much lower likelihood of mental health problems and much greater ability to control symptoms and adherence. So we found that quite often people did make quite complex risk assessments about whether they should carry their auto-injector, and that quite often these decisions were actually quite rational. They were rational for them, may not necessarily be rational in our own minds, but for the teenagers, they were thinking things through and they were making decisions that they believed were rational. And what sorts of interventions did we think might be useful? Well, in this particular area where we're talking about mood, depression, anxiety, teasing, and adherence to carrying your auto-injector, for example, then perhaps the most effective interventions may be things like cognitive behavioural interventions, maybe the use of motivational interviewing by healthcare providers, so increasing people's motivation to adhere, emotional disclosure, so interventions where people can talk about or write down how their thoughts and their emotions can help, and also some stress management and problem solving. Particularly for adherence, we found that there were some pilot studies looking at e-health interventions, so things like web-based, computer-tailored intervention, or interventions where you would have information coming to your smartphone, and things like automatic reminders, for example. The next things we looked at in terms of challenges were around self-management, finding that a lack of knowledge about the symptoms, a lack of knowledge about what your triggers are, what the treatments are, these were the main barriers to self-management. And actually having lots of knowledge, knowing what to do in order to keep yourself safe, was actually, it really did help improve self-management and improve confidence in being able to manage things for yourself. We looked at things like motivation and self-efficacy, and self-efficacy means very much the confidence that you have in your ability to manage. And in this instance, it's your confidence that you can manage your own food allergy. You're able to do that. And we found that often with our teenagers, they might not want to take responsibility for their self-management. And this is something that we're very conscious that we should be encouraging, as we'll come to in a moment. There's lots of emotional burden. So most adolescents did recognise the burden, and they did recognise the emotions that came with it, and that they needed to accept the condition, and they needed to make sure that they looked after themselves continuously. This was not something that they could only do every now and again, or something that was going to go away. So they did recognise that this was a condition that they needed to accept and to start to learn how to manage. And the family support was really useful in that, in helping them with manage. And we found that adolescents really do want to get support from their friends and their peers, but can often feel very embarrassed, don't want to feel different from their friends. And this is something definitely we think we could target very much in terms of helping adolescents improve how they can manage. And it's also important that healthcare providers also are competent and understanding of the particular issues that are very relevant for our adolescents and young adults. And the type of interventions that might work might be sort of educational type interventions. These might be group-based or nurse-led interventions. What we found worked the best out of any interventions were the ones that were led by peers. So remember, all the interventions were only for people with asthma, but what we found was that if we had children or adolescents taking part in an intervention that was led by older children who also had asthma, this provided the best improvements. This gave us some really clinically important improvements in children and adolescents being able to manage their own asthma. And we found when we've talked to teenagers with food allergy that they've said themselves that if they can talk to older siblings, older brothers or sisters, or older people who also have food allergy, they find this one of the most useful sources of support, because those older people with food allergy know what it feels like to have a food allergy. They know what the challenges are themselves, and they may have come up with some really good strategies themselves that they can pass on. And we found that this is really important. So peer-led interventions is something that we really need to focus on for our adolescents with food allergy. So this is a really nice summary table that we published at the end of the challenges paper, which just condenses all of those things I've just been talking about in one nice table. It has some fixed factors which focus on the individual, the demographics, age, culture and language. There are some disease factors there as well, so severity, whether the child has asthma and food allergy, for example. But there are lots and lots of modifiable factors, things that we can focus on in interventions. So things like coping skills, beliefs about our own health, our anxiety and fears, our knowledge, our social support network, and these all can have a big impact on how we manage. So finally, from the research and what we're doing with this task force is to look at how clinics are helping teenagers transition from being a teenager up to being an adult with food allergy. And we ran this survey across a number of different European countries. We had over 1,000 responses. And what we found was that actually clinics often did not have many resources or guidelines for transition. Many healthcare providers didn't routinely ask lots of important questions to their adolescents, such as, how confident are you in managing? How is it affecting your school? Do you feel anxious, etc.? They didn't really ask these questions. They didn't feel confident in asking these questions. So this gave us lots of information that we could use to develop our recommendations. So that was the survey that we sent. How do you manage terrific or terrifying teens? So on to some of the more practical things that we're suggesting and recommending that people can do. We've published these guidelines, and although these guidelines, as I say, are published by a European task force, they are guidelines that we see as very relevant globally and so also very relevant to North America, and a lot of the research that we looked at actually came from North America. So in terms of preparing for transition at clinic, what we've suggested is really important is that the clinics start early. So if your child goes to an allergy clinic where there is a transition process, and this is not always the case, it may be that your clinic sees children of all ages up to adulthood, but if there is a process, it should be started as early as possible. So early adolescents, 11 to 13-year-olds, definitely within the person's developmental stage. Sometimes an 11-year-old isn't ready, but sometimes an 8-year-old is. So as early as possible, start that transition, that helping the young person start to take responsibility for their own food allergy. Having a structured transition program within a clinic can be really useful. So it might be worth finding out if the clinic that your child goes to has a structured program that might help. And that we were recommending that they should see the same healthcare professional through to, if they do go into an adult services, that at least the first couple of times they go, they should perhaps see the same healthcare professional that they've been used to seeing in paediatric services. So if that might be the case for your child, it would be worth asking if they can see the same healthcare professional when they get moved up to adult services. And having an appropriate clinic environment is really important as well. And making sure that for some of the consultation that your child is seen on their own, at least some of the time, so that they can talk to their healthcare provider on their own. And they can start to get used to that and start to learn how to do that and have a little bit of confidence in talking to the healthcare provider on their own. Some of the things we recommend that are going to be really useful for parents to do is thinking about health literacy and getting lots of information about food allergy that we found is really helpful in managing food allergy. So the more you know about something, the better and easier it is to manage it. If you can get children to talk to their friends and peers and teachers, that is really, really helpful in self-management. And in order to make sure you have lots of knowledge, then using lots of high quality online resources can be great. And a lot of the patient organisations have these, and Food Allergy Canada has some fantastic resources to use. And if you can encourage your teenager to talk to their friends about their allergies and teach their friends how to manage emergencies, that would be really helpful. And finally, promoting adherence, simplifying medication regimes. If your teenager also has asthma, which is quite common when with people with food allergy, then giving them combined inhalers might be really helpful. And using different routines to support self-management might be really helpful too. But things like medication reminders, perhaps putting alarms on mobile phones, using apps. There's lots of apps out there that might be really helpful, and getting into routines also really help improve adherence. And then if you really need extra support, then perhaps consider interventions that use things like a CBT-based approach. So to continue with the sort of the practicalities, there's some practical toolkits that I've developed, and these are just some broad things that we think would be really helpful for children and parents to do. These are not an exhaustive list. There's lots of things that you can do, but they're just some things that might be helpful. For children, we recommend starting as young as possible, trying to encourage younger children to ask parents to show them how to use their auto-injector, teach them how to read food labels, help them with the cooking, the baking at home. Encouraging the children to talk to their friends or their siblings about their food allergy. And this can really help reduce the risk of any bullying, because having food allergy out in the open, showing that it's nothing that really bothers you, that's something that's not a big deal, means that there's nothing for the bully to get hold of and to use against you. Children find it a lot easier, as I said, talking to other children who also have food allergies. So if your child has the opportunity to do that, that we found works really, really well. And as I said, using the internet is great, and children do, and teenagers really like to use the internet, but making sure that they use trustworthy sites, they get information that is accurate. And so things like watching YouTube videos on how to use an auto-injector can be really helpful, as long as they're looking at videos that are showing the correct way. And a lot of the auto-injector companies have their own videos, which are really, really helpful. And so do patient organisations like Food Allergy Canada will probably point you to the good places where your child can watch things like that. For teenagers, it's very much the same, but it's moving things on a little bit, making sure that they know how to use their auto-injector, encouraging them to talk to their friends about their food allergy. If they can talk to their friends, they do find it much easier to manage. And if they can let their friends know what they need to do in an emergency, how to use their auto-injector, this can reduce anxiety for everybody, including the parents. Again, making a lot of use of support with patient organisations. But as teenagers get older, it's about encouraging them to problem solve, encouraging them to plan ahead. So things like if they want to eat out with their friends, can they check out the restaurant themselves beforehand, go online and look at the menu? Is there something there they definitely can eat? And if there isn't, they have to have the confidence to say, well, perhaps can we go and eat somewhere else where there's something that I can eat too? And this is why it's important that their friends know about their food allergy, so that teenagers feel comfortable in talking about that. And again, making sure if they look at internet sites that it's trustworthy information. For young adults, again, we're just talking about the same sorts of things, but moving things on. So planning ahead, problem solving, maybe practicing some role play. What would you do in certain situations if they came up? Talking through those situations and having plans of what if this happens, what would you do in that situation? And again, if they've got the support of their friends, I can't stress this enough, this is just so important, and making sure they know what to do in an emergency. If you do all of these things, and young people can practice doing these things on their own, and then they start to feel more confident. And finally, not to miss out the parents. What about the parents? Well, obviously, make sure you know how to use the auto-injector and practice regularly. It's the sort of thing that you can forget how to do quite quickly. So getting a trainer pen out and practicing is really important. Having lots of accurate information, making use of your patient organisations, sharing with the whole family is important. Avoiding things increases anxiety. So if you can share and talk about how you're feeling, talk about how you're managing as a whole family, then, and having things as open as possible, this helps to reduce the tensions within family, or can help reduce anxiety. But also, I think it's really important to say feeling worried, feeling stressed and anxious is normal. I've talked to a lot of parents, particularly mums, who have said to me they felt like they're the only ones going through this, and they must be mad. They must be, why can't they cope? I bet everybody out there can cope. And when you start to talk to them and say, you're not alone, this is really normal. Feeling worried and anxious is normal. I'd be more bothered if you weren't feeling worried. Then it really helps to normalize that and to help them to, it's normal to ask for support and help if you need it. So finally, just a little bit about interventions if you do need that additional support, if you do feel as if you need a little bit more help. And this is a really nice diagram showing what are the areas that we might look out for if you needed more help. Of course, if there's a lot of stress and anxiety and really poor quality of life, then that you're really struggling to cope with, then maybe some extra support would be useful. But also, we've got the other end of the scale, and particularly for teenagers, they may not worry enough, and that may drive you mad that they don't really think that their food allergy is a huge issue. They don't do their own risk assessments. They forget to take their EpiPen. And so for these teenagers, there is a higher risk of perhaps having an accidental reaction, and maybe they need a little bit more support too. So this is where psychological interventions are really helpful for these types of issues. There isn't any published work on this, not for children, but there are a couple of studies looking at parents, and there are some pilot studies out there showing that certain interventions are really, really helpful for quality of life, for coping, for anxiety, etc. Two key papers, just for reference, that have used cognitive behavioural therapy, and these have been focused on parents and shown that either a series of 6 to 12 sessions for parents who have very high anxiety, or just a one-off clinic-based session for parents who have perhaps lower levels of anxiety but still a little bit anxious. For both of those, in both of those situations, cognitive behavioural therapy has worked very well. We've also found that other things are working, and one of them is immunotherapy. This isn't widely available at the moment, but it's something to look out for. So where children are given small amounts of the food and build this up over time so that they can then tolerate a small amount of the food they're allergic to without having to worry about a huge reaction. And going through this immunotherapy has improved quality of life, but also oral food challenges. Now, oral food challenges are really useful if your child hasn't had a reaction for a really long time. You don't know if they're still allergic to the food or not. They can go into clinic and have some of the food in a controlled environment, see if they're still allergic to it. Now, this is really helpful in two ways. One, if they are still allergic to it, it really reinforces to the child, yes, you're still allergic, you do need to avoid this. If they've grown out of it, it means that they can now eat the food. And this has improved quality of life, no matter what the outcome. So even if the child is still allergic to the food, quality of life has got better because it reinforces that issue that, yep, you still need to avoid this. This is what we need to do. So just to summarise then, individuals with food allergy, they do face numerous challenges. We know this, and as they grow older and become more independent, those challenges change and they become more of a challenge. And parents can help by teaching their children to learn how to do things themselves. It increases their confidence as they get older. And the support of family and friends is really important. But if you need extra support, then psychological therapy may help. So thank you very much for listening.
Thank you very much, Dr. Knibb. That was a very informative presentation. We're now going to move I'm going to run quickly through some resources that I'd like to draw your attention to, and then we're going to get right to the Q&A. First off, just some of the resources that we have that are available to preteens and teens. Things that I would point out is our ultimate guidebook for teens with food allergies. This is where, when you were talking about peer interventions and peer-informed tools, that's what this one is all about. It's teen stories, sharing their stories with other teens. So really, again, focuses on peers. Allergy Pals and Allergy Allies is an online mentorship program. It's an 8-week program. We've got a registration coming up on September 25th. Start spaces are limited, but again, it is, you know, young children between the ages of 7 to 15 working with an older peer mentor. So it follows that whole idea of teens and young folks wanting to hear from somebody who might be a little bit older. We also have some other webinars that are in place for that group as well. When it comes to teens and young adults, I'll draw your attention to a few things. There's a tip guide on planning with food allergy at post-secondary levels, and I'm going to show to you how to get to that handout in a moment. We've also got some reaction stories and some stories from young adults around managing food allergy with roommates at university, as well as a couple of other webinars. And the last thing is we've got a managing food allergies post-secondary guide that can be helpful for parents to take a look at to understand what sort of expectations they should have of their post-secondary institution. The second last page I'm going to go through is just for parents. We've got another webinar that was recorded back in 2019 that I draw your attention to, and that was with Dr. Joanne Gillespie from IKW out of Halifax. So that is another one that if parents are wanting to go a little bit deeper on this, and we also have some additional links recommended on this page, as well as some links to different support groups across the country. And lastly, we also, this is resources for everyone. We know that the outcome we most fear is about anaphylaxis, and we work hard to prevent it. So taking a look at some of these resources that we have available are intended to help increase our confidence in understanding the signs and symptoms and properly treating them. So where can you find all this information? Well, if you go to the handout tab on your GoToWebinar control panel, you'll see that there's a spot where you can download a PDF under that, and that will take you to exactly the links of all those resources that we just did a very, very quick rundown of. Okay, so you will also get a copy of this handout as well with the webinar when we send you a recording of it. But let's get on to the questions. So Dr. Knibb, I'm going to ask you to turn on your webcam, and I will do the same. Great. Okay, well, thank you. We are delighted that you're able to spend some time with us. And we were also delighted with the number of questions that we got from people's pre-submitted. As I mentioned in the introduction, there's some consistent themes. And the first discussion area that I'd like to dig into is around parental anxiety. I'm a parent with 2 boys that are 19 with multiple food allergies. I get it. The research tells us that this is a real part. But what we really want to understand is, how do we keep our anxiety in check, okay, so that it doesn't transfer to our children?
I think it's a key thing that a lot of parents want to know, and there's not an easy answer. I think one of the things that may be helpful is to work out what specifically is really driving your anxiety. What thing are you most anxious about? Because anxiety could be, I don't think my teenager knows how to use their EpiPen. So if they have an allergic reaction, they won't know what to do. And if I'm not there to help them, something bad's going to happen. So if that's what's driving your anxiety, then you can start to think about, well, how can I manage this? What will help reduce my anxiety? So if it's my teenager doesn't know how to use their EpiPen, sit down with them and go through, how would you use it? Show me how you use it. Let's practice using it. Do your friends know how to use it? Let's get them in. You show them how to use the EpiPen. So everybody's really confident. You're confident that they know what to do. You're confident he or she has got backup friends who know what to do. That then helps reduce your anxiety a little bit. What then really helps is that letting them go out and do stuff, and knowing that, and then getting the feedback that they're safe. Okay, they've been out now and they've eaten now and they're fine and nothing's happened. My anxiety's gone down a little bit. Let's let them go out again. Because if you don't let them do things you're anxious about, your anxiety will never, ever, ever go away. It will only get worse and worse. So it's about exposure. We have to do the things that make us anxious.
Right.
It's one of the hardest things to do as a therapist. Is somebody tells you, right, this makes me anxious. Okay, so we're going to have to get you doing it, and the more you do it, the less anxious you get. So I always, if you think about, the first time you learn to drive and you go out driving on your own, how anxious does that make you feel? Now you've been driving for years, do you get anxious when you go out and drive? Right. So it's that sort of thing is right. How to start to manage anxiety.
Okay, well, and I think that is hard to step into that, to say, step into that anxiety and test it out and learn from that. Specific to this age category, though, we start to think about risky behavior. We start to think about, okay, I think they're getting complacent, right? And so or my child might not be vigilant enough. So you have kind of parents and child on either end of the continuum. Is there anything additional advice you would get if you're kind of you feel like your child's in one zone in terms of being complacent and you're maybe in the other end?
I think this is where seeing if you can get your child to have food challenges can help, because if the child hasn't reacted for a long while, it might be that they have grown out.
Okay.
You just don't know. And so going into clinic to get a food challenge, are they still allergic to it? If they are, they'll have some symptoms, and that will really reinforce to them, oh, I've had some symptoms now. That's what it feels like.
Right.
I am still allergic to this food. So that can really help, but you may not be able to get a food challenge referral. So again, it's probably more about sort of talking to your child, talking to your teenager about why are they taking these risks? What are they doing? And are there little things you can get them to just change how they're doing it? Make a little bit of a compromise. Yes, you might not think you're allergic anymore, but if you take your EpiPen with you, if something happens, you've got that as a safety net. So it all depends on what the behaviours are, what risks
Right.
are they taking, and to try and look at ways in which you can perhaps talk to them about just slightly different ways of doing things which will keep them safe.
Okay, terrific. Okay, so now let's move on to situations where we're not dealing with complacency, but we move to the other end of the continuum, where we're actually a little worried that we've got a young adult or a teenager or preteen that's got unhealthy levels of anxiety. Okay, what is it that parents can do to help their child cope, and what would you recommend, like when it gets to what some might call extreme anxiety? In fact, one of the questions was, how can I help my child overcome anxiety around food? Sometimes when extreme anxiety can actually get confused with a reaction. So what do we do in that situation?
Yeah, and this is sometimes can happen because when you're anxious, when you're stressed, heart rate can go, you feel hot, you feel sweaty, you get all of those reactions, those fight or flight reactions that we've all experienced, and they can mimic an allergic reaction, or they can mimic an asthma attack. And so if you have a teenager who is really experiencing these very, very high levels of anxiety, I would say at that point that might be some a time when you might need some extra support. Might be a time where you need to go to your doctor and say, look, is there somebody you can refer me to for some extra support? Because it might be much more complex support needs that are needed. So it's not just saying to them, oh, well, if you plan everything and you go out and eat, you'll be fine. Well, I'm not doing that. I'm not going out. There's no way I'm doing it. And so you may need some support by a psychologist who will help them to start slow, do small things, which helps them manage the anxiety and builds things up, which is like that exposure therapy. You've got to expose yourself to the things you're anxious about. You have to start at the smallest thing that makes you anxious, and then you build that up step by step. Because if you try and get a teenager to immediately go out and do the thing they're most anxious about, they won't do it. Or it'll scare them to death that much that it's called a flooding approach.
Right.
and it can make things worse. So where you've got those really high levels of anxiety, it may be worth asking for some additional support to try and help go through those anxieties at a very small level, bit by bit, and building up so that they can start to manage those anxieties better and learn different coping strategies.
Okay. Now, what about advice to those that are transitioning to university and college? Okay, they're moving into an environment we're not there. Okay, what is the advice that you would give to students starting university, moving into residence, entering a new environment? What should they be thinking about?
Yeah, we've talked to some of our students here at Aston University with food allergy who've done exactly that. And some of the things they've told us really works is to, be very upfront about their food allergy. As soon as they meet the people they're going to be sharing with, let them know, I've got a food allergy, this is what I'm allergic to. They've managed to sort out, this is my bit of the fridge, so this is where I can store my food so it's not in contact with your food. This is my cupboard with all of my cooking utensils in, so you know that because people don't know about food allergy, don't know about things like cross-contamination and those sorts of things. So if your teenager going to university has really good understanding of their allergy, how they can look after themselves, and they're confident in telling their roommates, their flatmates, this is what we need to do, then that can help keep them safe. And then most people we've spoken to who don't have food allergy have all said to us, we'd rather know, we really want to know, then we won't do anything that's going to put them at risk. We really want to know so we can help support them. I'd love to know how to use an EpiPen so that I could, help them if it was an emergency. So it's about having that confidence to talk to their peers, their friends, so that it's not affecting their lives. So they can say, yeah, great, I'd like to come out and eat, but could we go and eat at such and such because I can eat out there. And if they don't tell people about their allergy, then they may not know how to approach that. They might think, I could go out, but I can't eat or whatever. So yeah, it's about being as open and as knowledgeable as possible.
Right. And I guess probably practicing that in advance of having to go out for game day, right?
Yeah, it's starting early, doing these things on your own, building it up over time while you've got the support of your parents and the people around you who you've known for years before you go off to university. Role-playing stuff, trying things out, planning ahead, what will I need to do when I get there? What will I need to say? What sorts of things do I need to make sure I've put in place to keep me safe? Have I let whoever needs to know at the university that I've got an allergy? Those sorts of things. And practicing all of that sort of stuff before they go is really useful.
Right. Okay, I want to go back to another of the kind of a more specific question on anxiety. And in this case, it's for the young adult or the adolescent who has was confident and thought they were confident in managing their allergies and then just had a recent reaction, right? And then all of a sudden it's like, hold on, I was confident and now I've had this reaction and now I'm really fearful. What's your recommendation on how people work through that situation?
Yeah, and it's very, very much similar to what we've been talking about. I think quite often when you go through, and can be quite a traumatic experience, which is why we're seeing these sort of post-traumatic type symptoms. Quite often these symptoms will just resolve over time on their own. It's normal to suddenly feel very fearful and worried and anxious, whereas before you were fine. In normal situations where people have PTSD, when they've had an accident or they've been through a traumatic experience, you wouldn't treat them with cognitive behavioural therapy until at least six months afterwards, because usually those symptoms do start to resolve. But again, it is about focusing on so what now is making me anxious? What is the thing that I am now worried about that I wasn't worried about before? And what am I doing to cope with that? How am I managing that? Is it something that's a practical thing, or am I avoiding it? So am I now avoiding going out to eat because I went to a restaurant and that's where I had my reaction? If I never go out to eat again, I'm always going to be anxious about that. Can I go out to eat somewhere where I feel very comfortable, where I've eaten out lots of times and had not a problem at all? I know the staff, I'm confident in talking to them. Is there somewhere I can go where I can have a good experience, not have a reaction, get that positive feedback, then my anxiety reduces a little bit. And then I think, okay, perhaps I can go out and do that again. But it's not easy to do because it's making me anxious and I don't want to do it, or my child doesn't want to do it because it'll make them anxious. And I think what I found really a challenge in cognitive behavioural therapy with mums in particular is that if you treat somebody who's having a panic attack, you can say to them, your panic attack is just a panic attack. It's not going to cause you any physical, long-lasting physical problems. You're not going to collapse. You're not going to die. when you talk to a mum with a child with food allergy, you can't say that. You can't say they go out and eat, they'll be fine, because you've got no guarantees that they will be. So it's about managing the risk to a level that you feel happy with, but knowing that there is that risk, but can you accept that? And it's a lot of sort of acceptance that there will always be this bit of anxiety. It won't ever really go away. So how can I manage that anxiety, and what things can I do which helps me feel better about it?
Right. Okay. Well, let's go to. I've got two last questions. One is around just the transition of care, because we've been, we focus on daily management, and you had some slides that talked about how we should be thinking about transitioning the responsibility to the young adult, the teenager, and even in terms of their healthcare relationship, so that we're transitioning that interaction with the allergist or the psychologist potentially to the individual. What is your recommendation on when that transition should start, and what are the best ways for us to support that?
I think there are differences in transition with you as a parent teaching your child, and transition when we're talking about a healthcare provider, your allergist, whatever. So if it's you as a parent, as it just start as early as your child is able to. So if you've got a 5 or 6 year old who's saying, can I have a look at that, and how do I do that, and what do I do with this? Let them do it if they're able to, if they have an understanding. All children grow up differently and have different levels and they all catch up in the end. But we spoke to 8, 9 year olds who were making their own recipes, and reading their food labels and really enjoying taking control of their own allergy, owning their allergy. So as a parent, start as early as you can with your healthcare providers, your doctor, your allergist. Looking at the evidence, it seems that around between 11 and 13 years of age, start that that next phase, that phase of now starting to take that little bit more control, letting your young teenager talk to their allergist on their own for a little bit, not for the whole thing probably, but for at least some of it, so they get used to talking about it themselves without mum or dad there. And that might be a lot earlier than what an allergist would like to do it, but we've found again that the earlier you start, the better. So if you say to your allergist, this is what I would like, this is what the research is showing is really helpful, can we have a bit of a session where I go off and get myself a coffee and you talk to them on their own, I think that would be a really helpful way of starting that process off as they move, so they start to get used to it. As soon as they become an adult, they're going to be doing it all on their own.
Right. Okay, great. So last thing, your presentation absolutely reminded us of the importance of research to drive broad scale change and development and access to interventions. And you've been leading a global research project of one that's on the psychological health needs related to people living with food allergy. And Food Allergy Canada, actually, there's probably people in our audience that may have responded to the survey call that we put out in the spring and early summer. So thank you for those of you listening who completed that survey. But can you give us an update on what's the objectives of this piece of research is, and what we should expect coming up next?
Yeah, great. So really excited about this project. It's called the GAPS study, which is the Global Access to Psychological Services for Food Allergy. So we needed a short little name for it. And in the first step, we sent out this online survey. I think nearly 20 countries responded. We've got over 2,000 people respond, and that includes adults with food allergy, parents of children with food allergy, and the children themselves, which has been absolutely fantastic. What we found, sort of the headline news really, is that lots of adults and parents in particular are reporting that they do have that there is a psychological impact from their allergy. They are feeling stressed and worried and down and anxious, and in some countries that's 80 or 90%. In Canada, it's a little bit lower. I think it was maybe about 70%. but for most countries really high, apart from places like Germany, which is about 50%. So there are some country differences. But generally the pattern is there's lots of need out there. But then when we say, you know, have you been asked about this in clinic? Have you been referred to a psychologist? Have you been able to seek help? Very few people have. So there's a big need, and there's not the services out there to meet the need. We found this in the UK, we found this in America, we're now finding it sort of more globally, and the same in Canada. So the second part, we're just about to launch. We're going to start interviewing parents and adults in a lot more detail to find out, well, what do you want? What would you like? What sorts of issues have you faced? What barriers have there been to accessing any support? Is there nobody available, or is it too costly, or have you just not got the time? I don't have any childcare, you know, those sorts of things. And what would you like? What would you like to have? And then the final phase of our study will be to start developing some materials, which might be like an online intervention, something that people can access anytime they like, which will provide them with lots of things to help. And some of the things that I've been talking about today, to target things like anxiety, helping children to manage as they get older. So for adults, it'll be managing their own food allergy, and for parents, it will be managing their own anxieties as well as helping their child to manage theirs and their food allergy. And we're hoping that these are materials that anybody can access. So it will help sort of meet some of that need that we're finding is out there.
Great. Okay, well, listen, we really appreciate your time, Dr. Knibb. We look forward to the work that you've undertaken and how that will continue to drive impact and support for this community. So thank you very much for your time and attention. I think there were lots of snippets of good things for people to think about to support their own situation now. So I'd like to ask you to turn off your webcam, and I'm just going to make sure that I let people know what is happening next in Food Allergy Canada. First off, you'll get a short survey through GoToWebinar immediately after this. Please take some time to go through that and complete it. We rely on your feedback. Couple of notes around back to school activities. If you were looking to engage your child or your young teen into thinking about what they need to be doing and being prepared for back to school, think about looking at our what's in your backpack contest as a way to engage them. Tomorrow, we actually have an Instagram live session with our youth leader, Carl Dine. He's going to be talking to Ben, who's a teenager that lives with food allergies, and he'll be taking questions. So again, another great peer interaction opportunity for you to listen into or for your child. And then on September 28th, we also have a webinar coming up with Dr. Philippe Bégin from Saint-Justine in Montreal. He's going to help walk us through understanding the severity of your food allergy and where the research is at on that. So for those of you in the audience that are aware, Food Allergy Canada is a not-for-profit charity, and we are completely reliant on donations for the support that we do. So if you can consider a donation for our organization, it would be greatly appreciated. You can make a donation at foodallergycanada.ca/donate to learn more about the impact your donations will have. And we'd really like to thank our sponsors for this particular back to school webinar series, Chapman's, Odo's, Daya, and EpiPen. We appreciate that they rallied to support behind the back to school efforts. Thank you for your participation in today's webinar. You can view a recording of this webinar at foodallergycanada.ca shortly, and please share this with others who you think may benefit from this content. This now concludes our webinar.